Hello, hello. Happy Wednesday. It's Devin from the Sea Turtle Hospital at the University of Florida's Whitney Lab, tuning in to you guys for our Wellness Wednesday. How's everybody doing? As you can see, it's a beautiful day here in St. Augustine. We're pretty excited. The university just allowed us to open phase 1 this past week, which is pretty exciting to have a little bit of normalcy starting our way. The hospital has actually been operating already on phase 1, so we are working in split shifts and minimal to no overlapping. So phase 1 just basically is going to allow other faculty and employees and some students to come back on site. So we're really hoping that our phase 1 goes well, and then the hopes for phase 2 would be to start hopefully welcoming our volunteers back and start having our public tours again. So, hi Christy, thanks for tuning in. So I figured today we actually don't have Dr. Burkholter with us again today. She will be in tomorrow. So just to stick with schedule and our Wellness Wednesday, I thought it'd be a great idea to talk to you guys today about the amazing room that we're about to go into, our veterinary treatment room. First, I definitely want to point out something really important to us, and that's that sea turtle license plate. It's pretty cute, right? I'm actually originally from Connecticut, and in Connecticut, you actually have your basic blue plate, and then you have a lighthouse plate that you can choose from, that specialized plate. So here in Florida, we'll fast forward a couple years. When I originally moved to Florida, to re-register my vehicle, there's actually hundreds of plates that you can choose from, believe it or not. Hello, Robin from Europe. So when I went to re-register my vehicle, of course, I did choose the sea turtle license plate because it is definitely super cute and it goes to a great cause. I didn't know too much about it because when I first had moved to Florida, I actually was not working at the Sea Turtle Hospital just yet. It was just a little pipe dream that we had talked about, but nothing was really in the works. So, of course, still got that sea turtle license plate. So fast forward October 2015, when our pipe little dream became a reality and we opened our doors to the Sea Turtle Hospital. So that license plate grant is something that I got to see come full circle. When we first opened, we applied for that Sea Turtle license plate grant from that Sea Turtle license plate money, and we were actually granted $30,000 to get the room that we're about to go into up and running. So it's about $20 every time you re-register your vehicle. And basically that money goes into a big pot, and then every year the different sea turtle hospitals in the state of Florida can apply for different grants based off of that license plate. So we're fortunate enough that every year since we've been open, we've been able to apply for different grants based off of that sea turtle license plate. And but our first year, our big exciting year, of course, the year that we opened, we got the money to pretty much get this room up and going. So I'm gonna take you guys in here today. So it's a room that you guys have seen a lot of lately in our Facebook Lives, but we haven't really had a chance to really talk about it because usually we're in here with Dr. Burkholter and some of our patients. So this room is pretty much the brains of the operation. This is where everything happens. It's our treatment room, our surgery room, our office space, our pharmacy, kind of everything happens in here. Luckily, we're a smaller staff, so we do pretty well with making this room transform into kind of whatever we really need it transformed into. I have our sweet little patient here, Mr. Fuzzy, and he's just demonstrating what it would look like on a typical exam day with our veterinarian, like you guys have seen. So, we'll go around the room. So it's kind of just like a small animal practice. For a lot of you guys that have dogs and cats at home, you might be familiar with going into your vet. And some things here you might see that are a little familiar to that same type of operation. We have our floor scale, and that's really important because we weigh all of our patients So we want to make sure that everybody's at a good, happy weight, and those weights are being checked daily on most patients, but if not, absolutely once a week. And that's really important for our veterinarian, Dr. Burkhalter, to make sure these animals are nice and healthy and happy, and they're getting the right amount of protein while they're with us. And then I kind of pulled out all of our equipment today just to give you guys a little glimpse at it, and we'll talk a little bit about it. So we have our ultrasound machine right here, which is a newer machine to us. We are pretty excited about having that. We actually got that donated to us by Dr. Liz Watson down in Flagler Beach. Basically, the ultrasound scan uses high frequency sound waves to make an image of internal body structures. Our veterinarian, Dr. Burkhalter, really likes to use this equipment to try to locate our sea turtle kidneys. So unfortunately, those organs are a little bit difficult to see when we do our routine CT scans on our patients. So the ultrasound machine is really great because it allows her to locate those organs just to make sure they're healthy and happy like we want them to be, because unfortunately we have found that those tumors will grow in the kidneys. So we have our very fancy CO2 laser, which is pretty exciting. That CO2 laser is a carbon dioxide laser, and it's pretty standard for the care in removing the fibropapilloma tumors in all of our sea turtle patients. So you guys know that we are the FP hospital, so all of our patients do have FP. So all of the patients that are here with us do undergo multiple surgeries depending on their tumor score, and that CO2 laser is what our veterinarian, Dr. Burkhalter, uses. But the really cool thing about that CO2 laser is it basically uses wavelengths and highly absorbed by water contained by the soft tissue. The highly focused laser beam, which is really fun to say, causes the expansion of water within cells and causing them to explode and vaporize. In addition to it, it actually will cut tissue and simultaneously seal blood vessels and nerve endings, which is really great because the result, it reduces any type of hemorrhaging, swelling, pain, or tissue trauma, which of course is critical for all of our FP surgeries. So it's a pretty neat, very, very important tool that we have here at the Turtle Hospital. So once our patients get healthy enough that they can undergo surgery, we'll use that to remove those pesky tumors. So again, we have Mr. Fuzzy here just to demonstrate how we would have a turtle on the table with our awesome little turtle tamer. Of course, we would have myself or Ashley or Jessica or any of our other amazing volunteers hanging on to those animals. But then we also have here is our Therapeutic or cold laser, which is also really neat. That was actually also donated to us from another veterinarian down in Flagler. We appreciate all the support. But that Therapeutic laser utilizes low-level laser lasers to stimulate tissues and enhance healing and provide pain relief. Cold lasers explode the energy, which increases their metabolism. So it's pretty neat. It also helps promote healing and relieves pain, which is super important and helpful with these guys when they're doing the CO2 laser removal. And then we want to make sure that we keep them as healthy and comfortable and happy as we can after those surgeries, because it can be a little stressful. So it's a great tool to help stimulate that healing process and keep them as comfortable as we can during their time after surgery. And then we have our our anesthesia machine. So reptiles are cold-blooded, so we do still use anesthesia for most of our surgeries. The only thing is they metabolize everything so slow because they're reptiles. So surgery is usually pretty time-consuming, but we really try to keep it under an hour because of how slow their metabolism really does work. So then over here we have our TV. So like you guys have seen A couple weeks ago, we did utilize our screen that you guys got to see, and we used that with the rigid endoscope that you guys got to see when Dr. Burkhalter was scoping Jacques Cousteau, which we are also able to find the sex of the animals when we're doing that scope, which is pretty neat. But basically that scope is used to perform internal exams and procedures of areas where invasive surgery access is limited. So our turtle friends obviously live in their shell. I'm sorry, Looney Tunes lied to you. Turtles do not come out of their shell. They're in their shell for their entire life. So it's a little challenging when you're trying to get to the organs that are underneath that shell. So that rigid scope is really, really useful and helpful. It allows us to examine the coelomic cavity for internal tumors, which is definitely what the primary use for it is. But we can also use it because it will help us to remove any type of fishing hooks that unfortunately these guys will ingest, and then examine their esophagus and their trachea. And it is used for a few other diagnostic procedures, but the main one is to really try to look for any internal tumors that unfortunately can get on those organs. So you can tell we really do go above and beyond. We are a full functioning hospital. That's our treatment board that you guys have seen. You're pretty familiar with some of those names, and I promise you, you're not here to hear me talk about our medical equipment. You're here to see those turtles, and of course I'll get you guys out on the deck in just a minute. But I just wanted to talk a little bit about our treatment room. So this is our laboratory space. We do a lot of blood work in-house, but we also have the ability to send complete blood out for a complete blood chemistry, which is also really, really important that we do with our patients. So you could see here, we do a couple, blood is routinely collected from patients as a key indicator of overall health and their process and progress. Depending upon the case and the patient's treatment schedule, blood is collected for a variety of diagnostic testing, actually. When an animal first comes in and throughout their time with us, we're checking a basic blood is what we like to call it. It's checking the glucose, a PCV, which is a total packed cell volume, and then also a total solids. But then what we also do is we make blood smears or slides. That's for a CBC. And that's utilized to evaluate complete blood cell count. That information is very valuable to evaluate the status of our patient's immune system and the red blood cell count. So the fun thing about turtles is they're always giving us a challenge. So in our mammals, you can usually use a machine to read these smears or these blood slides. But unfortunately, in turtles, we can't do that. So we actually have to manually do that. And we have a wonderful certified veterinary technician on our staff that is able to read those using our microscope. So it's pretty important. That's done almost weekly. You can see this is Eugenie's CBC from last week. It's a pretty good blood smear slide, I'd have to say myself. So just to give you an idea, we also have our Icestat machine, and our Icestat machine allows us to test individual patient blood gases. This will measure the amount of oxygen and carbon dioxide in the blood, but it can also measure the pH of the blood and how acidic the blood can be. It also will do the concentration of CO2 in the blood, sodium and potassium levels. So that is a really important little instrument that we have for our more critical patients, and we really try to use that post and pre-surgery to make sure everybody's nice and happy. And then usually based off of all of these blood, we'll give fluids. So we have a couple different fluids. That is actually some cleaning with betadine for our wound care. But our fluid therapy is pretty important. Patients will receive fluid therapy for various reasons throughout their rehab with us. It provides hydration, electrolyte support, delivery of various medications, blood pressure support, just to give you some ideas. There are multiple types of fluids that are available for these patients, and they are not interchangeable. So each are used for their own specific purpose, and we get those from our veterinarian, Dr. Burkhalter. Once we run this blood work, we'll allow her to know those results, and then she'll usually give us our treatment. Hi, Dad, from Oxford, Connecticut. So yeah, this is the little brains of the operation. It really can transform into anything. So we also have the rest of our lab space here. Then we have our autoclave, which allows us to clean all of our surgical instruments. Then we have our office space, microscope, all of our patient charts, and then we have our pharmacy behind that little locked cabinet. And then a really great tool that we also have is our patient charts. So we utilize an online system called Wild One. And the great thing about Wild One is you're able to put it in the cloud, and we can access this at home. So if myself or Dr. Burkhalter or Ashley are not in the office and you're wondering what's going on with the patients and what the day is looking like, we can actually log into the system at home and check everything out. So you can see everybody has their own individual little tab, their information, where they're from, why they're here, where they're located, out on our deck. And then we'll click on Richard just to show you. When our veterinarian is here, Dr. Burkhalter, she'll actually put all of her medical notes in here too, which is really great, so that we can go back if we have any questions or concerns, or a lot of time our researchers will really give us a challenge and start asking some questions about a patient that we released back in 2016. So this is a very, very important tool for us here at the Sea Turtle Hospital, because we're able to put all of our medical notes, photos, updates, anything in there, and then we can have full access to it if we have to go back. And then, of course, like I just mentioned, we usually have our veterinarian here with us today, but she couldn't make it in today for some family support she needed at home. So she'll be able to log into that tonight and see everything that was done today and have a good idea of what our day will look like for tomorrow. So tomorrow I will have Dr. Burkhalter here, so I'm going to kind of leave this room set up a little bit for her, and then we'll get some of our patients out and discuss kind of the treatment plan for the next week or two. Hopefully I'll be able to pop on towards the end of the week with another little Facebook Live and get you guys some turtle time. But I know that's why you guys are here, not to hear me talk. So let's go for a little walk and say hi to our rotten little reptile friends. As you can see, it's beautiful out today. We are definitely excited that we are slowly starting to open back up. Again, the Whitney Lab just moved into phase 1 of reopening, so it's allowed faculty and other employees and some of the students to come back on site. So that's great news for the lab, absolutely. All right, so we're checking on Richard. Richard's looking really, really good. You guys have seen him on a couple of our Facebook Lives before. He's actually currently getting 570 grams of seafood a day, but he's definitely loving it. So we're excited to see what his weight is and what his blood's gonna look like tomorrow. You guys want to show me some hearts for Richard? So we're actually hoping that as things slowly start to open back up, that hopefully we'll be able to get Richard in for his or her first CT scan. We take these animals off-site for CT scans, usually when they first come in and they're stable enough, and then we'll usually recheck that every 3 to 6 months, kind of depending on the patient. So we're pretty excited that it looks like hopefully we'll be able to get him in for a CT scan within the next week or two. Oh, the glare's bad, sorry. So, but there's Richard. He's looking really good. We gave him a new hide, which is an enrichment that we give our patients. He seems to not really be too interested in it just yet, but usually it takes them about a week or two, and then they realize that it's pretty cool. I'm sure Delta is in hers that we'll see in just a minute. And then, of course, Miss Eugenie. Eugenie's doing well. She probably has 1 or 2 more tumor removal surgeries until she is tumor free. She's looking pretty good. You can see her surgery sites, those incisions on the top of her neck there. But she's looking pretty good. And then we'll check in on Miss Delta. So yeah, see, I told you Delta would be in her hide. So you can tell after they get kind of used to it, they really do like to hunker down and hang out in there and hide. It's a great enrichment for them. Maybe I'll go on this side. You can see her little face. Delta, do you want to come say hi to your fans? Maybe. Maybe not. So Delta is actually tumor-free right now. We're just monitoring closely a couple of her incision sites. She had one of those pesky tumors right on the side of her cheek. So unfortunately, that just takes a little bit longer to heal than the other sites. So maybe I'll be able to hop on tomorrow and show you guys Delta's incisions and how she's healing. Oh, she might want to come say hi. Hi, Delta. You can see that spot underneath her chin where she had surgery. Your fans are here, Delta. And then, of course, everybody's favorite, Edward Scissorhands. She's cruising along. I jokingly call her the Labrador of the hospital right now because she definitely has the personality of a lab. They definitely all have their own individual personalities. My original background was working with dolphin and sea lions. So when I came to the turtle hospital, I was a little worried that I wouldn't have that kind of connection with the patients like I had been used to, because they were reptiles, but they definitely all have their individual personalities and their likes and their dislikes, and they really do tend to have their own uniqueness, which is really great. So Edward is definitely that type of patient that she'll eat kind of whatever you give to her. She's pretty hyperactive and likes to swim around. Hello, Beacon Falls Animal Hospital. Thank you for your support and all your tank top purchases. And I'll cruise back around to Richard again. And then I'll send you guys off. Thanks for hanging out with me and the turtles. Hopefully, I'll be able to pop back on again towards the end of the week when we have Dr. Burkhalter with us. We could talk more turtle. But I'm glad you guys got to see our treatment room and learn about some of the unique procedures that we do and the equipment that we have. And we really appreciate all of the support. Everybody's been so wonderful. I know it's a little challenging right now because we are closed but still caring. So unfortunately that means we can't have our public tours. But we're trying to get you guys your turtle time as much as we can. As you can see, everybody looks pretty good. Hi, Cam. Thank you for being a turtle lover. Looks like Delta. Oh, there she is. You're still begging. All right, well, thank you guys. Happy Wellness Wednesday from the Sea Turtle Hospital at the Whitney Lab. We hope to check in with you guys again real soon, but as you can see, our turtles are nice and happy and waiting for their doctor to come in tomorrow for their exams. And we'll talk to you guys soon.